Good afternoon, everybody. I'm going to get started. I hope everybody is well today, and if you're watching live in the UK, I hope you're looking forward to the bank holiday weekend coming up. My name is Katie Jacobs. I work with HR leaders at the CIPD, and I've been hosting our coronavirus webinar series. And this afternoon, we're going to be discussing a really, really important topic, the psychological impact of this crisis and how people professionals can best support staff in dealing with anxiety, with grief, and with uncertainty, with a whole kind of spectrum of concerns. Joining me to discuss this afternoon, a fabulous panel. We've got Ben Wilmot, Head of Public Policy at the CIPD, Dr. Emma Donaldson-Fielder, a Chartered Occupational Psychologist and Director of Affinity Coaching and Supervision, and Cheryl Samuels, Head of People Strategy, Health and Wellbeing at NHS England and NHS Improvement. And I've just been told she's also, if that wasn't enough, big job, Deputy Director of Workforce at Royal Free Hospital. Thank you so much, everybody, for joining us today. As ever, I'll just run through the housekeeping. The session is being recorded. It will be available on demand via the webinar section of the CIPD website. And you can also access recordings of all of our previous webinars there, as well as sign up for future sessions. Next week, we're going to be doing them on diversity and inclusion. And we're also going to be presenting CIPD research that reveals how employees are feeling about work in the time of coronavirus. And I'll remind you about that at the end of the session. If you want to submit questions during the webinar, and please do submit your questions because we always leave plenty of time for them, and the best bit of this often is the interaction that we have with the audience. Could I ask you to use the Q&A tab at the bottom of your screen? Please don't use the chat box for questions. A reminder that for legal advice, CIPD members can call our HR Inform helpline. It's available 24/7 and you will get an individual response. And a reminder that we're updating our information and resources all the time as new information becomes available. You can head to the CIPD Coronavirus Hub for more. And the final point from me on housekeeping is a reminder of our new Wellbeing Hub and Helpline. That's available for members in the UK and Ireland. Together with award-winning workplace wellbeing provider Health Assured, we're now providing CIPD members with free help and support via consultations with qualified therapists. Members can access the phone number and the online services via the membership benefits webpage, and you'll see more details about this at the end of the session. And I think it's given what we're talking about today, a really, really great benefit for us to be flagging at this time. So let's get started with the topic. For many of us, anxiety continues to run high as uncertainty continues over how long we're going to be living in the shadow of the coronavirus. It's a really, really personal thing, and people are dealing with a whole spectrum of worries. Some people are concerned about returning to the workplace or traveling on public transport. They might be worried about family members. They might be dealing with grief and bereavement. At the same time, many of those on furlough are struggling with the psychological impact of not working, and they're worried about the future. How long will they continue to be on the scheme and what comes next? And there are those that are desperate to get back to the office because they're finding working from home just too challenging and difficult. So when dealing with such a wide spectrum of concerns, how can people professionals best support people and line managers to deal with the psychological impact of the coronavirus crisis? Our running order. First up, Ben will provide some context and he'll give an overview of the importance of prioritizing employees' mental health and well-being during times of uncertainty. Then Emma will discuss the important role of line managers and leadership in supporting employees and offer practical guidance to people professionals to support managers in doing so. And then Cheryl will cover psychological well-being and the lessons that we can learn from the NHS. And I'm sure there's a lot to learn there because you've been working so hard on it. So that's it from me for now. I'm going to hand over to Ben. Ben, a reminder, you need to unmute yourself and on with the show.
Thanks, Emma. Sorry, Katie. Yes, good afternoon, everyone. So, yeah, the UK is facing the biggest public health crisis in a generation as a result of COVID-19, both in terms of the direct effects of the pandemic, but also its impacts on people's mental health. People are worried about the threat to their health and the health of their loved ones, and many have lost family or friends and are dealing with grief. And there's also concerns about job and economic security and the negative effect of socialisation. A recent survey of working people in the UK found that 35% said the pandemic had negatively affected their mental health. And CIPD research, which came out last week, showed that just over 4 in 10 employees are anxious or very anxious about returning to the workplace as lockdown measures are unwound. Next slide, please. Now, employers have a fundamental duty of care for their employees' physical and mental well-being. So under the Health and Safety at Work Act, to protect the health and safety of employees at work, which includes their mental health. And employees who have a mental health condition may qualify as disabled under the Equality Act and will therefore be protected from discrimination during employment. And employers are required to make reasonable adjustments for employees with disabilities. And what is reasonable will depend on the circumstances, the nature of the disability and the resources available to the employer. However, in the current situation, the minimum standards set by law are unlikely to be sufficient to support employees through the many different potential mental health and well-being impacts of COVID-19. Employers should make changes or adjustments wherever possible to support all of their people's mental health, because it's the right thing to do, but also because it will support people's morale, their motivation, and their contribution. Next slide, please. So the impact of the pandemic will affect people in very different ways. So it'll depend on the sector they work in, their job role, whether they have caring responsibilities, their household or family circumstances, and individual characteristics such as their health, their gender, their age, or their ethnicity, and also their personal resilience or makeup. All of these will mean that the impact will be different, and employers will have to think about how they respond to the different challenges that people face. Next slide, please. And the other key thing is that it will impact in different ways for different groups within organisations. So for those who've carried on working and attending their place of work through the COVID-19 crisis, so that for the essential and key workers, many of those will have been working under increased pressure and stress, and will have associated higher risk of mental health problems. And then you've got people who have been working from home and will continue to work from home. So obviously some people have benefited from the experience. They've enjoyed not having to do the commute. For some people might even have benefited from increased work-life balance, but for others, the experience has been pretty negative. They've suffered from isolation. They found managing and balancing caring responsibilities with the closure of schools extremely difficult. And then we will need to provide ongoing support for people who are continuing to work from home. But then also we've got the people who have been working from home or have been furloughed and are now returning to the workplace. And we know, as I said at the outset, that a significant proportion of people are anxious about coming back to the workplace. And that is likely to be particularly the case for those people who have caring responsibilities or live with people who have pre-existing health conditions, for example, or are going to have real problems in terms of managing their caring responsibilities while schools largely remain closed. Next slide, please. So to help a safe return to work, CIPD has identified 3 key tests before return to the workplace. So first of all, is it essential? And as the government's guidance makes clear, that anyone who can work from home must continue to be able to work from home wherever possible. And if not possible, is the work deemed essential, or are there other options? The second test is it safe? People's health and safety is absolutely paramount, including their mental health. And any return should be gradual to test health and safety measures can work for larger numbers as the return to work happens gradually. And I think the key here is really the third test. Is it mutually agreed? There needs to be a clear dialogue to ensure people's circumstances are worried and worries are taken into account. So this needs to be at the heart of the risk assessment process. Next slide, please. And the role of line managers is also absolutely fundamental. And I mean, Emma's obviously going to be picking up this in more detail, but the importance of line managers in sustaining a positive psychological contract through this crisis is paramount. So line managers need to prioritize carrying out sensitive and supportive one-to-ones, both as part of the reinduction process for anyone coming back to the workplace, but on an ongoing process. Behaviors around empathy, support, flexibility, these are key for all employees at all times. And it's crucial that line managers understand the importance of finding time to have these conversations and prioritizing these, particularly at this time. And then, of course, line managers need support. Some of these conversations are extremely challenging. Dealing with people who have suffered, trying to help and support colleagues who have suffered a bereavement, who are really struggling in terms of balancing caring responsibilities. Providing support so that for managers, so that they know how to help employees who are in complex and challenging situations. And then, of course, line managers themselves will be under acute pressure to manage conflicting demands. So it's crucial that how managers are managed recognises that the pressure that they're under. Next slide, please. Now, we know that early intervention is key, and so managers play a crucial role in spotting the early warning signs which suggest that people may not be coping. So the sorts of things that managers should and can pick up on, whether people are working excessively, they're not taking breaks, there are uncharacteristic changes to mood, that there maybe people are finding it difficult to prioritize, or they're indecisive, they're signs of stress, and changes in emotional response. So are people increasingly irritable, which is out of character? Are they overreacting to problems or issues? These sorts of signs are the things that line managers should be able to pick up on. Now, this doesn't mean that line managers need to become mental health experts, but what they do need to be able to do is to have those conversations, those open conversations, use empathy, listen to people so that people are more likely to open up, and then managers can help refer them to sources of support, HR, occupational health, employee assistance programs, and because once you start to, sometimes people can't see the wood for the trees, and actually talking it through with a supportive line manager can make all the difference in starting to navigate a way forward. Next slide, please. So CIPD has been continuously developing our resources to support HR and line managers through this crisis. And our most recent guide, which was published this week, is around mental health and returning to the workplace. And this covers the law, how employers can help prevent problems from rising, early intervention, responding to mental health disclosures, and supporting return to the workplace, and crucially, that key advice for line managers. Next slide, please. And this is just one of the bits of guidance or guides on our COVID-19 resource hub, which has a whole range of advice, information and guidance on all aspects of the challenge that employers are facing in relation to the workplace and the workforce during this pandemic. That's it for my initial contribution, but obviously happy to take questions later.
Thank you, Ben, for setting up the subject so well. I just want to flag, because quite a few people are asking, yes, this webinar is being recorded. Yes, you'll be able to access it later today and circulate it wherever you wish. And yes, the slides will be available from the CIPD website. I will say that again later, because I'm sure more people will ask. But now I'm going to hand over to Emma to do her 10 minutes.
Hello everybody, and so delighted to be on this webinar today, and thank you so much to Katie and Ben for setting up the topic so well. It is such a vital time for mental health, and I think it's so important that we have these discussions and that we really think through what are the key issues and how do we provide the best possible support and care for everybody who's affected. So I'm going to just reiterate probably some of the messages about psychological impact and build on what Ben was saying about the role of line managers. I'm also going to give some research-based behavioural frameworks that my colleagues and I have developed in collaboration with the CIPD. But I really want to home in on this is not just about what people are doing, it's about how they're doing it, and some of the things about attitudes that underlie that. And linking across hopefully to some of the things that Cheryl will say, that the role of compassion and compassionate leadership and the importance of that. And then stepping back and taking a more systemic perspective and okay, so how do people professionals fit into all of this, and where does your role lie? Not just in providing the kind of frameworks that I'm going to offer, but also in that general, more broad culture, attitudinal piece. So next slide, please. So just to reiterate everything that Katie and Ben have said about the kind of key impact here that the pandemic and COVID can have on mental health, and also how different it's going to be for everyone. So I think one thing to recognise is that even before any mention of the pandemic, there were already quite high levels of mental health problems. Statistics suggest something like 1 in 6 people already had a diagnosable common mental health problem. So that's anxiety or depression. And so if you add to that the psychological strain imposed by the initial COVID kind of crisis, if you like, and the lockdown and all of the repercussions of that for those who are continuing working, those who are working from home, all the figures around domestic abuse, the impact that's going to have on individuals, whether they're isolated or they're with family members, it's going to be so different for different people. And then you add to that now the uncertainties and the concerns around what I'm calling the recovery phase. Some people are talking about the return to work phase, but of course some people are continuing to work. Some people have been working all the way through. So I think this is just about a new phase. So with all three of those factors, the risk for mental health and the high levels of emotion that are likely to be around is really significant. But recognizing that that's going to be so different for every individual, as Ben was saying, depending on their external circumstances, depending on their internal perspective and attitudes and so on. Next slide, please. So I'm sure that pretty well everybody who's watching this webinar is very clear that the line manager's role is important, and Ben put a very clear case for this. So I'm not going to linger too long on this, but just to say, if you see on the left-hand side of this slide, those are the things that I was already talking about. I have been talking about for many years about the line manager's role in employee wellbeing, and particularly psychological wellbeing. So the line manager themselves is potentially a source of either stress or wellbeing. They also influence the exposure of their team to the organisational level. So they're that link between the organisation and the individuals. They also have a vital role in that local level spotting problems, which is what Ben was pointing to with those list of things to look out for. as a people professional, you rely on the line manager essentially to be the local eyes and ears for their team. And any sickness, absence, return to work, line manager is going to play a key role. And anything that you or the organisation does about well-being, that gets filtered through the line manager. So vital, whatever's going on, line managers are vital. But what the early research that's coming out about COVID-19 suggests that line managers become even more important in a crisis like a pandemic. So the IES recent research suggests that where employees have less contact with their line manager, they have poorer mental health. Now we could think of all sorts of reasons behind that, and it may not, there may be an underlying piece about the relationship with the line manager that causes both, or that is linked to both. So that's an interesting question. There's also research suggesting that the leadership is vital for role modeling key behaviours like compassion and building trust, and also thinking about frontline workers and being recognised and having a recognition from your line manager is vital to your well-being. So there's all sorts of reasons why during the COVID situation line managers become even more important, as if they weren't important enough already. So next slide, please. So what I'm going to do on this slide and the next is just point you towards some frameworks that you can use that are potentially things that you can hand out to line managers to help them think through their behavioural response. First of all, to kind of high stress situations, how do they prevent and manage stress in their employees? And we've got a research-based framework, as I said, that my colleagues and I developed in collaboration with the CIPD and with the Health and Safety Executive and other bodies. And also there's a framework that's around return to work. And again, there's a guide there that can be handed over. And we're in conversation with the CIPD about how we produce something that's perhaps even more targeted to line managers at this current time. So keep your eyes open for that. That'll be over the next few months. We'll be developing some tools for line managers and a toolkit that helps HR and people professionals promulgate that for line managers. Next slide, please. I thought you might also like a link to the results of some other research that we did, which was specifically looking at the role of line managers for remote workers. So again, there's some tools, there's some questionnaires and so on available at that link. Next slide. But as I said, what I really want to home in here, so that hopefully those tools will give you some useful materials, some things to think about at the behavioural level. But I think there's something really important when we're in this kind of high psychological turbulence time of thinking a bit beyond and below and inside the behaviour. Now, all the research that we've done shows that it's the relationship. So it's not behaviour in isolation. This is about a relationship between two human beings, a line manager and their team member. And so that building that relationship effectively is, oh, slides have jumped on. Building that relationship is absolutely vital. And I think it's at that relational level that line managers begin to be able to understand all the different needs of the different individuals that work with them and for them. So there's something about that key relationship. And part of that is about, and particularly in times of great uncertainty and ambiguity, there's something about being able to really be with all of that discomfort, particularly the external discomfort of the uncertainty, not knowing, it's ambiguous, there's so much change going on, there's paradoxical situations. How do we hold that and not rush in to try and find solutions? It's such a natural human thing. How do I deal with, or just freeze and not be able to handle it at all? There's something about that the classic serenity prayer, give me the courage to change the things that I can change, the serenity to accept the things I can't change, and the wisdom to know the difference between the two. So there's something here about how can we and line managers and how can employees develop this level of wisdom and ability to be with the uncomfortable. And that links to emotions as well. And Ben already mentioned the vital importance of listening to employees and being empathetic with them, being able to be with all that emotion. And it'll be very different for different people. So how can we give attention to people, give that really important listening space, accepting all of these emotions, saying this is normal, everybody's having emotions, but it'll be really different for different people. So don't feel that whatever you're feeling is not okay. It is okay. So providing that kindness, that support, and creating a sort of psychologically safe space, creating a space where people feel that they can talk about things, that they have time to think things through, and have opportunities to have new perspectives. Because often if we're on this kind of track of trying to find a solution and resolve it all, we're not able to take that step back and think about different ways of seeing it. And it's partly about empowerment, both for the line manager, but also for the employee. And fundamentally, this is about compassion, it's about kindness, it's about care. So just to enlarge on that, thank you. The kindness and the care, I just wanted to mention a couple of compassionate leadership models, and there's a lot more out there that you can explore. But there's something about how compassion, for example, in the NHS framework, is about that basic attending, is the sort of foundation, really paying attention and listening. Bringing in empathy, bringing in an ability to be with the distress without being overwhelmed by it. And that's a difficult balance sometimes to strike. Having an understanding, seeing different perspectives, and that step into actually helping and making a difference. And Rofi Park has also developed a framework for compassionate leadership, which builds on a kind of being a compassionate person yourself, and then taking action to actually build compassionate cultures and enable compassionate responses within your organisation. Next slide, please. So just to finish on a kind of a systemic perspective, this is about being able to build cultures in which compassion and care are at the forefront. And of course that has to include self-compassion and self-care for everybody. So as people professionals, this is partly about, and it's a really difficult time for people professionals, there's so much for you to do at the moment. Can you also, perhaps in your teams, perhaps with your line manager, get the support that you need in order that you can then provide that caring space for line managers, role modeling this, really offering that embodiment of compassion and care, that then line managers are able to provide that to their employees, so that there's this cycle, this system, and then of course that enables the employees to be looking after customers, clients, patients, service users, whoever it might be, and that feeds into the system, so the purpose of the organisation. So this is a systemic cycle, and I think it's about how can we all play our part in creating a culture that allows time, even in this rather frantic situation, there's time to listen, there's time to care, there's a moment to slow down and reflect and think of different perspectives, and deal with all of this turbulence, being able to be in a kind of a stable, resilient place with it, and all the challenges that everyone's facing. So that's everything that I have to say, but I'd be delighted to discuss it further in questions. Thank you.
Thank you so much, Emma. That was really fascinating. A really great point at the end there about HR needing to look after itself. And just to flag, we did do a webinar on that a few weeks ago now. I think time is losing meaning, but I think it was a few weeks ago, which you'll be able to find on the CIPD website. People making comments about getting hold of the resources, and we will make those available for you. It will either be later today or at the latest early next week. But if you check our social media channels, we'll make it clear when that happens. Before we move into questions, and please do keep your questions coming in via Q&A box, I'll hand over to Cheryl to give some insight to how this is coming to life within the NHS. A reminder, you need to unmute yourself, Cheryl.
Thank you, Katie. Welcome, everybody. Thank you so much, Emma and Ben. You've done a great lead in there around picking up some of the points around compassion, self-care, the importance of teams, and also having those psychological safe spaces, which are absolutely key at a time like this. So I think probably what I'd probably like to just start off with, probably if I can have the first slide, please. So I just want to kind of set this context around the fact that the NHS, as some of you will know, we employ about 1.3 million staff across the country. We have over 200 hospitals across England, and there's over 7,000 GP practices. And coupled with that, we also have about 10 ambulance trusts and others. So the care landscape, the health and care landscape is quite complex. And coupled with that, we also have social care, where there's over 23,500 independent care organisations that are providing care and also linking in with our hospitals. So I think it's important to note at the outset that the landscape is complex, and the challenge for us was to make sure that we're able to support our workforce in the most effective way so that they could deliver care in the most meaningful way possible, and also to make sure that the general public got the level of care that our clinical staff wanted to provide, but also noting that all our support staff equally need to be able to give of their best and to deliver what's needed in a timely way, and we needed to try and cut through the bureaucracy. So I think that I've kind of pulled this slide together because we've actually got Dr. Sonia Wallbank is the clinical lead who's actually overseen all the work that we've been doing nationally, and she pulled together this PAR model which has been shared widely across the NHS and outside, and essentially that really gave everybody a really clear understanding quite early on in preparation for the pandemic. So we'd started to think about how we were going to prepare ourselves for the pandemic, what sort of worries and things that people will be having. People will be thinking to themselves, am I enough? Do I know what it is that I'm doing? Then they're worried about their family. And I guess taking all of those things into account, we tried to actually make sure that our resources continually evolved to kind of sort of replicate or understand that actually these are the various phases that people will go through. And then once we got into the active phase of the pandemic, where it was starting to reach its peak, we knew that it was going to become more intense, and they were going to see more death. They were going to see things that they weren't used to seeing, the level of guilt that our staff would feel around those that were dying around them, those that have survived, as well as losing colleagues and things along the way as well. It's also quite difficult. And so if we knew and we were prepared for that in terms of what it would be like in the active phase, we were able to kind of tailor our offer to our staff so that that was more meaningful and more closely met their needs. I guess now that we've kind of passed through the active phase, certainly in London, we are now sort of starting to move to the point where we're actually reviewing all that we've had in place and starting to prepare for recovery, but also noting the fact that there's a chance that we may well find ourselves with another surge as we may get a second wave. And in that, we need to make sure that we're able to best support staff who are sort of experiencing things like survivor guilt, the moral injury, but also thinking about how they're going to thrive and grow as they continue to try and manage this. Next slide, please. So in doing that, we pulled together a national package of support that was available, and I thought this would probably be the easiest way of explaining it to a mixed audience. So essentially what we pulled together was an umbrella national helpline service which is staffed by the Samaritans, and that is open. It's one number, and all staff across the whole of the NHS, so all 1.3 million staff, have the opportunity to be able to call should they need to, for any reason, whether they've got anxieties, worries, concerns, and it could be anything from financial worries if their householders, had staff that had partners that are furloughed. It could be because they're worried about childcare. It could be because they've done a shift and there's been concerns and things that have been raised on the shift. It may well be that they want to talk about how they feel. So the Samaritans is an open door that they can actually contact. It's staffed between set hours, and they're able to access that support freely and easily with one number that's known amongst everybody. In addition to that, we'd also partnered with Shout, and they provide a text service that's available, and that runs different hours, and that allows staff who maybe don't necessarily want to have a conversation with someone, but they want someone independent to speak to. They can actually text that person, have a human being that texts them back and provides them with practical support and advice on what they could do. And the feedback so far has been really positive, but I'll come on to that shortly. When you actually contact Samaritans, you also have the opportunity to also get bereavement support, because we recognise that there are lots of staff that are losing colleagues as well as their own family members. And so Hospice UK have been kind enough to provide us with a bereavement support package, so staff can call for that bereavement support should they need it, in addition to any occupational health or EAP support that they have in place. We've also worked in partnership with the NHS Leadership Academy. So some of the things that Dr. Emma was talking about around actually the line management capability, the importance of leading in difficult times, having those really good relationships with line managers, and creating the open spaces and safe spaces, more importantly, for staff to be able to talk about the things that are really worrying them and of concern. We'd actually partnered with them and actually pulled together some line manager toolkits, and we've also put some training that's available via something called Silver Cloud. So there are modules in there that staff can actually go into in order to get support. I guess the other thing probably also to say is that every Wednesday we run a webinar, and that webinar is open to everybody to attend in the NHS, and it's publicised across the board, and it covers different topics. But we also have external people that actually come to kind of talk about lots of different major incidents. So our offer has very much been shaped by lots of the experiences that have been had by experts and people that have been involved directly with things like the Manchester bombing, the Ebola crisis. We've had the military, the London 7/7 bombings. There's lots of we've had lots of industry expertise help shape our offer, and so that's how we've kind of come to this. And then the free access to physical and psychological support apps. So we've partnered with a number of apps, so Headspace, Unmind, Sleepio and Daylight, and the Stay Alive app, which obviously focuses on people that are actually in crises and needing very specific support. So all those apps, there's a choice as to which ones it is that you feel that are most appropriate for you, and they support in terms of anxiety, sleep deprivation, general worries, etc. So you can download any of those apps. They're free to access until the end of the year. And to date, we've had over 115,000 downloads of it across the country. So we know that staff are absolutely accessing the self-help. And then in addition to that, we've also got some group one-to-one type support, which we're launching through the Common Rooms approach, which is essentially a virtual space for debriefing that we've created online for different groups. But if there are questions about that, I can take that a bit later on. Can I have the next slide, please? So this slide just simply summarises the actual help, the overarching national programme that's available. and what the national offer is. And so from that you can see all the things that we have thought about, and we've really taken the time to consider people as a whole person, and not just focused on their area of work. And I guess I would probably encourage others to ensure that they're thinking about their workforce in the most holistic form, because actually if any of these areas are worrying staff, actually it prevents them from being able to give of their best. So next slide please. So some of you might be wondering exactly how much has all that yielded, and what is it that people have been doing. So today, up to last week, it's fair to say we've had just under 2,000 calls to the actual wellbeing helpline. When this first started, I think we were on about, each call was taking probably about just over half an hour. And usually I think a Samaritan's call is normally around about the 15-minute mark. So actually now we're starting to see, as we've come through the pandemic, that the duration of the calls are actually coming down now. And I guess people are probably a bit more focused on what it is that they specifically want help with. The text line conversations, we've had 925 of those, and that's mainly people calling, usually after their shift, who just want some very specific assistance or help. And as I said, the apps and self-help modules, the apps, as of this week, we've had 115,000 downloads of those apps. So what we can see is that people absolutely are engaging with the actual self-help. The majority of people we know will be able to come through this, but there is a section of people that will need more than psychological support. They will need psychological intervention. And those will be the areas that we will be working on and are working on at the moment. The other thing just to say in all of this is probably just to note that we've also pulled together something called the people.nhs.uk website. And on that, one of the big asks throughout all of this was that we were asked to actually pool all our resources in one place, so managers didn't need to go all over the place looking for different things. So feel free to have a look at the website if you want to. We've had over 96,000 visitors to the website, and the pages have had over nearly 130,000 visits. So it clearly is, you know, an area that we're very focused on and developing further. Can I have the next slide? So I wanted to just kind of draw your attention to the fact that we've kind of pulled together a framework, and so Sonia kind of kindly pulled this into something that was easy for us to manage. So this essentially is the recovery plan, and this is the framework in which we're kind of working at the moment. So we're trying to make sure that we are actually creating those opportunities for our managers, our staff, our colleagues to be able to listen. So we've put leadership circles and things into place. We've also got we've also looked at all the apps, looked at making sure that they're fit for purpose, and we've also highlighted any gaps and things that are needed. I won't go through all the areas that are highlighted on here, but hopefully you will have had a chance to actually just have a look, really just to note that the fact that we've really taken that holistic approach to actually trying to look at people as they go through the different cycles as we go through this pandemic. Next slide, please. So I think from the pandemic itself, there's been an awful lot of things that we've learned along the way. And I think that one of them is the importance of compassion, self-care, having those safe psychological spaces. And one of the key things we learned from the military, who obviously operate in quite difficult circumstances when they're stationed abroad, and that is actually just making sure we realise that resilience resides in teams. And because of that, it's so important to make sure that the line managers, as mentioned earlier, that they really know what they're doing. So I think that COVID-19 has taught us so much. And I think the recovery will require our leaders to be more dynamic. They need to create compassionate, civil and respectful workplaces because of the highlighted inequalities that we've seen as a result of this pandemic. And the compassion gap is one that we need to fill, because there isn't always that willingness amongst others to show compassion to those that are dissimilar to themselves. And so we're now needing to think about how we make that work more effectively and start to close the gap. So thank you very much for listening.
Thank you, Cheryl. That was brilliant. Before I go into kind of more broad questions, just a couple of specific ones for you, Cheryl. People have asked, could you just repeat the website address for the resources, maybe slowly so people can write it down?
It's www.people.nhs.uk.
Brilliant, thank you. And could you also just refresh the slide, sorry, not slide, the apps. So it's Headspace is one I remember.
Headspace is one, Unmind is one, and Sleepio is another, Daylight is the other one, and Stay Alive app is the one that focuses around suicide, because we know that A&E departments have received, very sadly, a number of failed suicide attempts, and so it's important that anyone that is at risk of that there is some support that they can actually use there. So the app's there for people to use, and it's free. Thank you, that's great.
Emma and Ben, do you want to unmute yourselves, and we'll take some questions with our last kind of 10 minutes or so. So somebody's asked about, what about where organisations may now consider staff working from home to be something positive, they've adapted technology to support them, and they might want to retain that moving forward. So it means that return to work is not about returning to an actual physical space. What impact do you think that will have on mental health, given that staff aren't returning to something that they were used to before? And how can you kind of manage that? Can I put that to you first, Emma?
Yes, certainly. I mean, I think the key thing here is one of the things that Ben mentioned. It's the mutually agreed piece. I think there's, and it goes back again to relationships and dialogue and space to listen to people, because it may be that some people are absolutely champing at the bit and would love to stay working from home, whereas for others it's really not working. So I think a one size fits all for people is not going to be an engaging or psychologically caring way forward. So I think that discussion is really important. I think there's also something really important about individual risk assessment. So both, if people are going to stay working from home, a risk assessment of that physical workspace, but also a risk assessment of the psychological risks to that individual of working from home. And I think those two need to go hand in hand. And that could again be the line manager role, or it could be something that people professionals design and roll out sort of centrally.
Thank you. I'll put that to you as well, Ben, that add in another question, which is somebody's asked, as an HR professional, what do we do if management wants to implement a rollback but there isn't mutual agreement for employees? What advice could we give?
So a rollback.
Coming back into the work.
And there is an agreement.
Yeah.
Yeah, I mean, I'll take that first one. I think the key is that employers should try as much as possible to consult and do everything they can to reach agreement. But also, I think there is the opportunity to also move very gradually and test different approaches. So it might be that you've got people who are keen to go back to the workplace, and so potentially you can pilot approaches with those individuals so that you can test whether social distancing measures are effective and can build confidence in the system. And then those people who are more anxious will have some reassurance that the approach has been tested. I think the other thing is, we do have the job retention scheme, which has been extended until October, which does mean that particularly for people who are have pre-existing health condition, or they are caring for people who might be more vulnerable, there is an opportunity to keep some people on furlough and hopefully over the next few months the risk of infection will decrease, and you can bring people back gradually while supporting their mental health and well-being. But I think the critical thing is that really finding the different ways that you can support and meet people's issues and move slowly, gradually, and in consultation.
Thank you. Got a question from Kay. Thanks, Kay. She said she's really interested in the idea of closing the compassion gap, and that makes it so important for us to focus on raising awareness of unconscious and conscious bias. Have you got any good practice to share? And Cheryl, can I put that to you first?
So I think that the whole piece around compassion, I think that there is something about the fact that I think people are thinking compassion is all about kindness, and it isn't always just about kindness. I think that there is, we have got some resource that's around compassion and looking at how you try and encourage people to be more compassionate. And so what we have started to roll out is the compassion circles. And so that allows you to kind of get into the space where you're able to actually have the conversation on a one-on-one, but start to think about what compassion really means to you, and get you to be in that kind of thoughtful space, and then to actually reflect and think about how you reflect that outwards to others. But I think it is clear that people absolutely do show compassion where people are very similar to themselves and less so to others. And I think that in the NHS we've most definitely seen that, hence why the headlines around the inequality and the treatment of BAME staff has been so heavily talked about. And I think it is because there is a lack of compassion, and it's because of the difference, and we need to really work on how we actually close that gap.
Emma, do you have any thoughts on kind of building compassion?
I think there's something really important here, sort of building on what Cheryl's just said about a sense of common humanity, and just recognising everybody else is a human being doing the best they can with what they've got, and that you know, we all need compassion. So we need to give ourselves compassion, and we need to give every other human being compassion. But I'd also build on what Cheryl was saying about this is not just because some people just think it's kind of light and fluffy. Actually, compassion requires a lot of courage, both because being with somebody else's suffering is hard. You know, dealing with emotions and the resonance that brings up for us is a difficult thing to do. So actually, from that perspective, it requires a lot of courage. But from the other perspective, it also is about a kind of having the wisdom and what's called fierce compassion. So, you know, when somebody actually needs feedback, you know, then no, that is not okay. It's the compassionate thing is to actually give them that clear feedback. So there's a whole element of courage that's part of compassion as well. So I think that's really important to emphasize.
Thank you. Somebody's asked that looking at lessons learned so far from the pandemic, what are the views and recommendations from panelists on how to encourage more flexible working, even things like a 4-day working week or a 9-day working fortnight? Ben, do you have any thoughts on that?
Well, I think the pandemic has demonstrated that, you know, many more people can work from home and can work flexibly, and you know, hopefully it will mean that we do have you know, looking ahead, a bit more of a step change to more flexible workplaces and all the advantages around sort of opportunity and inclusion and support that they can provide. So I think, but I think the key issue is also choice as well, because I think you know, that's the issue that Emma was highlighting, is that, you know, for some people, you know, people like to be in the workplace. They value the relationships with their colleagues and that environment, while others, you know, and potentially because of their family circumstances or care responsibilities, they would benefit from a much more remote working, and in lots of ways I think it's going to be a blend sometimes, and I think that's where employers need to really focus on, in terms of learning the lessons from the COVID-19, talking to their staff about what has worked, what hasn't worked, what their preferences are, and then trying to find a way that suits both the organisation and the individuals in their organisation going forward.
Can I just add one other thing there, Katie? So in the NHS, one of the things that we have done is actually implemented the sort of 3-question model. And so essentially you ask 3 questions, look at what went well, what didn't go so well, and what do you want to retain as a result of the pandemic. It's something along those lines. I can send it to you afterwards if it's helpful to share with others. And essentially we're capturing all of that feedback from everybody, and then we're actually then going to review it all and then start to map out exactly what it is that the new normal looks like, because I think at the moment there's lots of anxiety about what the new normal looks like, and as Ben says, we do need to think about how we actually become more flexible, but I think that is going to lead to a significant change in policies and procedures going forward that are sort of set in a more traditional style, when actually we need one that's actually a bit more agile, a bit more flexible, a bit more open, a bit more compassionate in some cases too. And I think that we recognise one size doesn't fit all, and I think the inequalities have meant that we actually need to really place an equality lens over a lot of the HR practices and policies that we currently have in place, and strengthen them.
Thank you. Emma, specific question for you. How do you foster psychological safety when people are working from home, especially as there's been such a focus on being risk averse?
Yes, I think it's a really interesting question, and this is some of the area. Well, this is the area that we were looking at in the remote workers case, and again, it's about relationships. So just because you're not meeting somebody face to face doesn't mean that you can't build a good relationship with them. So I think that psychological safety is about building the relationship. And using that relationship then to create the time one-on-one or in a team to create that sense of listening ear, time to think, time to be, time to really explore individual needs. So I think it's still about relationships, even if they have to be built in a more virtual way.
Thank you. And before we finish, I'm going to squeeze in one last question. I'm going to shove a few together because we've got a few on line management. So what are our kind of top tips for HR people to support line managers at this time? Where should our priorities be as a profession? And somebody's also asked, how do we stop them kind of getting carried away and going a little bit too far? Cheryl, do you want to take that first, and also if there's any kind of practical tips that you can give on what you've done within the NHS?
So I think probably one of the things that we do need to do, I think we need to be bolder, we need to be braver, and we need to be open to actually having those what are sometimes uncomfortable conversations. I think also line managers need to get used to the fact that they're not expected to have all the answers. And that they need to actually have those open discussions, but admit and be open about the things that they don't know, and they'll find that people are more than willing to fill in the gaps if they're willing to actually be open in the first place. I think that our lessons, I guess, learned in the NHS as a whole, I think one has been around the whole inequality piece, as I've mentioned earlier, and the need to actually put an equality lens over a lot of the processes and procedures, even things like all the free offers and things that we've had. You think to yourself, actually lots of the food parcels and things, they're not quite diverse in nature in terms of all the food and things that come in, and therefore we could be looking at actually broadening our offer to kind of meet the needs of those. And it's the same with the apps. We're actually looking at apps that actually specifically target specific groups. So I think that's most definitely I think those are a few things that I'd say that we've taken away. with this.
Before we close, Emma, Ben, any kind of quick tips on what we should prioritise to support line managers? Emphasis on the quick, Emma.
I think it's both about what we support line managers to do, but also about how we support line managers to be. So it's that combination, and for professionals, it's about role modelling that as well. It's not just the doing, that's important, but it's also about the quality of being.
Yeah, and Ben, a final thought from you.
I mean, I think just to echo that it's, you know, it's how people manage. It's not the what, which is of course the task. Managing the task, you know, is crucial, but it's how managers do that is crucial, and how they use sort of, you know, emotional intelligence and empathy and listening in that process that makes the difference.
Thank you. So I'm afraid that is all we've got time for this afternoon. So thank you very much to our panel. Thank you everybody for putting your questions in. There were some lovely comments, Cheryl, about how proud people are to work for the NHS right now. So we'll try and export those and send them over. A reminder that the slides will be available on demand from this afternoon. So you can download those and share them with peers and colleagues. A reminder that you can sign up to future webinars via the CIPD website, and that our sessions next week are on our research into how COVID-19 is impacting employees' working lives and diversity and inclusion. Also to flag that I'm actually on holiday next week, so I won't be here, but you'll be in really good hands, I'm sure. I'm sure it'll be a great week of sessions. And a final reminder about our new wellbeing support for members in the UK and Ireland, with a free 24/7 telephone helpline staffed by therapists and provided by Health Assured. You're seeing a slide about that now. I think all the stuff we've been talking about today about psychological wellbeing just brings home how important it is as HR professionals that you take some time to care for yourself as well. But that's it from us this afternoon. So thank you very much for watching, and we will see you next time.
Thank you.
Thanks very much. That was wonderful. Thank you.